I don't know how to turn it on. Good morning, everyone. So the panel talk is in the auditorium. This morning, we have Dr. McKinney. He's completing his PhD at the University of Utah on using brainwave technology and advanced statistics in mental health assessment. This enabled Dr. McKinney to study many different aspects of brain health, ranging from sleep to the benefits of being in nature. His academic expertise is complemented by over 8 years of experience promoting innovative neuroscience research and communicating its impact to the community through his role as research director for Branch Out Neurological Foundation. Since completing his PhD, Dr. McKinney has been building his startup company, Bit Cortex, to gamify engagement surveys and create engaging, data-driven educational experiences on brain health. When not thinking about the brain, Ty can be found exploring nature, connecting with Alberta's growing tech ecosystem, or planning his inevitable transition to living in a tiny home in either Scandinavia, the Utah desert, or the Canadian Rockies.
Awesome. Thank you so much for having me. Is this picking me up? Oh, okay.
It is wireless if you want.
Perfect. That'll work a little bit easier. Oh, I think that's actually working from this distance. All right. Thank you, everyone, for having me. So just to get a quick scope of the room, how many people identify as data scientists? Okay. How many people identify as business professionals? Okay, got another good mix. And how many people identify as scientists, just normal scientists? Got a few people. So the goal for this presentation is for us all to learn a little bit more about each other's work and how it can be a little more collaboratively when we approach data science challenges. So as you probably got from the introduction, I specialize in health data, particularly as it relates to psychological and brain health data. And I want to start off with one of my favorite quotes. All models are wrong, but some are useful. Has anyone ever heard the adage garbage in, garbage out when it comes to statistical models? So really what I'm hoping to get over the course of this presentation is for us to think a little bit more critically about the different kinds of data that we're using and how we can be creative with how we're using that data in order to get bigger insights. Because again, we can apply the most advanced machine learning algorithms, develop the best AI solutions, but if we're not using good data and it's not modeling a theory that is actually helpful, it might only have marginal impact. So let's see if we can get a little bit more creative for how we can structure the way that we're using that data. So this is why I start off with that question up at the very top. So I'm actually not a data scientist by training. I'm a neuroscientist by training. And because of the kinds of data that I always ended up working with, I became a bit of a statistician. So I tend to approach data science problems from a different perspective from a classically trained data scientist. So that's where I'm hoping that we can have a bit of a dialogue between the way that I approach these kinds of problems and the way that everyone in the audience approaches the problems, that we can have more of an interface that way. And this is one of my favorite Venn diagrams of all time. Basically, good science, as I've been trained, requires the overlap of 3 different things. You need a good theory. And this is how you think about how all the different things are relating with one another. So in my experience, this is where data science tends to not necessarily latch on as well, because they tend to work with their clients who know the theory for them. They're getting the data science to help out with the complexity of the problem. But at the end of the day, if you don't have a good theory, then it's not necessarily going to matter what data you're modeling, because again, garbage in, garbage out. There's also methods. So when it comes to the methods, this is how you're acquiring the data, what exactly is happening. So this is where you can solve that garbage in, garbage out problem. If you have good methods as far as either novel data that you're acquiring or the data streams that you're taking advantage of that are already existing, then you can be much more impactful for how that data gets leveraged and used in different ways. And then finally, stats is where all the people with the data science background probably have the most expertise. So really we're looking at how we can bring these 3 components of the Venn diagram together in order to have much more impactful solutions when we apply data science to all the different problems that I'm sure you've heard about not only today, but over the course of this entire conference. So to give you a little bit of a background, this is how I originally got exposed to data. So when I was doing my degree at the University of Alberta, I was working in a lab where we were studying brain oscillations within the hippocampus. That's a region of the brain that's really important for learning and memory. And basically, my job was to mess up the hippocampus by giving different drugs to the rats and see how the brain waves respond. So my type of data that I really enjoy is squiggly lines, aka time series data. How many other? Oh,
we can hear you.
okay. Wasn't sure if that was being needs to be in there for the audio recording purposes. How many people work at time series data in the audience? Okay, so we got a little bit of overlap there. I think that time series data is absolutely fascinating for a number of different reasons. And for everyone that just raised your hands, hopefully I'll be able to give you a couple new analytic tricks for how you can make sense of that data. And for everyone that didn't raise your hands, hopefully I can inspire you to care more about time series data and incorporate it into your next projects. So I'm not going to go into any details about this specific study, other than to help you realize that that you can use these squiggly lines and you can get a lot of great insight into what's actually happening in the brain from it. So some of those analytic approaches I've been able to adopt over to other projects that I've been working on. For example, working with human data, as I'll talk about in just a moment. But this is to show you that we can get a lot of insights from other scientific disciplines and how we want to manage data, and that you might find a lot of unlikely insight from unlike minds and unlike disciplines. So while I was working in that lab, this is where I discovered the problem that I ended up deciding I want to dedicate the rest of my life towards. So I had a friend and a colleague during my undergrad where she was struggling with some depression, and she ended up trying to get treated for this, and it was not eventually successful. Turns out she had thyroid cancer. She was able to get treated and was able to have a full recovery. But this really made me realize that how we do assessment within mental health is fundamentally flawed in a lot of ways. We're using technology that for the most part has been updated since World War II. And that is questionnaires and interviews. So as you can appreciate, there's a lot of potential subjective bias that goes into that kind of data. And the most sophisticated approaches that are industry standard within psychiatric assessment, more or less, they just digitize the form. So you're still fundamentally filling out a questionnaire, just now you're doing it on a computer as opposed to with paper, which is one step up. You can actually now use that data in better ways, but fundamentally it still has a lot of the same flaws and limitations that we've had since World War II. So given that I was working in this lab with this brainwave data, I saw that there was an opportunity to use advances in biometrics to really revolutionize the way that we're trying to do psychiatric assessment. So this is what I decided to pursue for my graduate studies and PhD. So I went down to the University of Utah and I was in a clinical neuropsychology program. So I got some experience in doing assessments, mostly focused on cognitive assessments with patients that had brain injuries, as well as people that were looking to get assessments around ADHD, learning disability, and anxiety, differential diagnosis between those. And this is where I realized the pragmatic limitations of how you can collect novel data. And I had a lot of my ambitions kind of kiboshed a little bit, but it opened up new opportunities as well. So as you can see, I was still working with time series data from this graph on the side there, except now the time series data was coming from humans as opposed to rats, but it still was fundamentally squiggly lines, but now we had more channels so I can turn them into fun graphs. And this is where I'll transition to the problem that my startup is actually trying to solve, which is how can we do a better job of assessing mental health risk, particularly within workplace settings. As we've come to learn over a few years of customer discovery now, the issue is not that there's a lack of resources in the healthcare system and in the workplace when it comes to mental health, but it's that those resources typically aren't utilized to their full extent. And this can be for a number of reasons. One of the big ones is just stigma. Nobody wants to acknowledge that they have a mental health condition, and by extension, they don't necessarily seek out help for it. So that's one big barrier towards addressing this problem. And unfortunately, this ends up being very costly for employers. So one way that we can try to understand this problem is by taking this financial cost and breaking it down into its individual components. And we could apply data science methodology to this particular problem and try to do a better job of estimating the cost. Based on some data that was collected from KPMG, we know that over the last couple of years in a lot of professional industries, there's been about a 10% turnover rate when it comes to burnout. So these are people that are voluntarily leaving the workforce. They're not getting fired. They're saying this job is not for me. I want something else. This tends to primarily be impacting younger Canadians. It tends to be primarily impacting women and other marginalized identities. So overall, this is a big problem right now within the ecosystem, and we have an opportunity to try to provide some solutions to it. And we can break this down into a number of individual component costs. The first one is absenteeism. So you can think about this as you're not showing up to work because you are struggling with mental health. So you're having a sick day per se. That's one component of this cost. There's also short-term disability, where you need to take some time off in order to manage your mental health. And this can be anywhere from 3 weeks to 3 months. That's a cost for the company because, one, you're not at your position being productive, but the company still in many cases paying for you to have a salary, and they often need to reduce, also have someone covering your duties while you're gone. Eventually this can turn into an unfilled position if people don't recover from that, which leads into the turnover statistics that I was just mentioning, which then gets into all the costs associated with rehiring people. How many people have been involved in the rehiring process, either as on the HR side or as the technical person in the interviewing process? Does anybody like doing that? Oh, I'm guessing you're the HR person? Management kit. So you get the joy out of bringing the new people onto the team. But given the choice, would you rather work with a team that you already have or continue to be hiring on new people as people leave from the company? And then finally, if this problem isn't managed properly, it can lead towards higher insurance premiums. So overall, this can be quite a costly problem, both in the short term as well as the long term. And if we just model these costs, we're not necessarily going to understand what is the cause of this issue. So instead, we need to have a bit of novel data collection in order to get a better sense of what's driving these problems. So this is where we're starting to return back to the theory. So if we look at the scientific literature, we can see that scientific theories of burnout really have 3 individual components. The first one is chronic stress, which I like to differentiate from acute stress. How many people enjoy going running or working out and getting sweaty? So that's a really good example of acute stress. It's very healthy for you. Your brain loves it. Your body loves it. And as a result, your psychology is going to love it. What is problematic is when that stress response system that's happening while you're running stays on long term. This is where you start getting dysregulation within your body's hormone systems, and it causes a whole bunch of different health consequences, burnout being just one of those. If those hormones continue to float around in your body indefinitely, this can result in reduced cognition. Basically, there's a brain network right at the crown of your head that is responsible for your focused attention, and if it's not functioning properly, you're not going to be able to do your day-to-day responsibilities with nearly the fidelity that you would probably like to. And then the third component of burnout is cynical attitudes. So if you're in the service industry, like a waiter, this is not necessarily the biggest issue because the customers might just get substandard service. But if you're in the healthcare profession and you're providing services to other people, this can be extremely impactful because now you're getting a lower quality of care. And this can have a whole bunch of additional ripple effects from there. So overall, this is a huge issue. We want to get a better sense of what is happening and how we can try to intervene in order to mitigate this issue and provide people with access to those resources. And this is where it's going to come back down to how can we do a better job of using our theories to inform the models that we're using to tackle these problems. So I was actually really surprised over the course of my graduate training that most statistical models I learned about were really just modeling straight lines. How many people like modeling straight lines? Yeah, relatively easy. You got a nice list of assumptions. So to those of you that raised your hands, you're probably familiar with this formula that's up on the board there. Y equals mx plus b. It's a formula for a straight line. And again, we use this all the time. It's very robust. Sometimes to get a little more complicated, we do a multiple regression where we just add multiple different terms to determine what is the angle of that straight line. But fundamentally, we're still modeling a straight line. And as a result, there's going to be a lot of limitations to that. So the question that I would like to pose is, what if we modeled something other than a straight line? Or what if we used a straight line to model something more interesting and creative? So this is where I want to make it a little bit more of a dialogue. What are some of the people that raise their hands as data scientists? What are some of the models that you're using? And let's see if we can figure out what you're geometrically modeling. Any volunteers? What's even if it's a straight line, this is your chance for us to have that dialogue.
Like logarithmic decays.
Pardon?
Logarithmic decays.
Logarithmic decay. So
mx plus log x. Plus
okay, yeah. So in this case, you're modeling a curved line.
Yes.
Yes.
Pressure decline in a roll well.
Yeah. So again, curved lines have some interesting properties that we can take advantage of. Turns out in nature, things tend not to be linear when you zoom out and look at the complexity of everything that's going on. If you zoom in, it can be linear, but when you zoom out, it tends to be nonlinear. So just adding a simple curvature can really improve the performance of your models for capturing that extra degree of complexity. Let's see if we can get someone else. What's another model that you use?
Decision tree.
Pardon?
Decision tree.
Decision tree. So if I recall correctly, that's basically a series of binary decisions that you're making in sequence in order to come up with an eventual classification, correct? So you can think about that as modeling a sequence of straight lines. Anytime you're trying to make a binary decision, you can model that mathematically as a straight line. So that's one way that you can use straight lines a little bit more creatively. But then no matter what model you're using, there's always going to be an error component. The only three things that are certain in life are death, taxes, and error. And as a scientist, I get really excited about the error because that's what I want to try to minimize. And this is where good theories can help out. So this is where the different estimation procedures that you can use can really come into play in order to help out with how your model performs. So as a neuroscientist that's relatively classically trained, the first estimation procedure I learned was ordinary least squares regression. Not particularly exciting, but surprisingly robust. Then I learned about maximum likelihood, which more or less does the same thing, but more efficiently. And you can do other nonlinear models using this estimation procedure. And then since I started working with Bit Cortex, I've learned from my lead developer about a whole bunch of other data science techniques that we can use in order to do a better job of minimizing that error, making do with less data in order to fill out our model. So this is where the nonlinearity comes in. So this is a paper that I published over the course of my PhD, which more or less was asking, what if we model cognitive functioning as not just a straight line, but as a composite of different types of patterns? This is where the time series data really comes in. So one of the fundamental assumptions of this approach is that we live in a complex world where there's lots of perturbations and you're not going to be able to understand anything. The way that you get around that is you look at what are stable temporal patterns that exist despite all that chaos that's present. And when you look at these kinds of temporal patterns, you can really break them down into two individual components. There's interindividual change, which you can think about as growth. This is the logistic model that you were talking about previously. And then you can also look at interindividual variability, which is those short-term fluctuations, which is typically regarded as noise, but using this chaos theory approach to doing data to modeling, you can actually leverage that to get information about your phenomena. And that's what I'm going to spend the next 8 minutes of my talk going through. And what my startup company is doing is trying to use gamification in order to get that time series data more reliably, so that way we can make these kinds of inferences. So at the very end of this talk, if you want to get some experience for what this data looks like with respect to your own health, we've got a demo for you. So here's the basic equation that we can use in order to model a thermostat, which is one way that we can use a straight line, but more creatively. And what's important is that in the time series on the right is we can plot something like stress, which is one of those components of burnout, as a function of time, and you get a squiggly line. Again, my favorite type of data. And then we can start thinking about what can we do with this in order to make it more useful. And one thing that we can do is we can calculate a change score and put that into the outcome of this equation. And more or less what this does is it approximates estimating a first order derivative. To anyone that has a background in this, you know that derivatives are when you have something that's minimized. So really what we're able to do by doing this is find out where is there a point of minimum as it relates to those perturbations. Where is there a point of no change? And this has a lot of really useful information because we know where something is not changing, then that's a starting place. We can start to build things around there. So again, if you think about a thermostat, the point of no change in your home is wherever you set the little needle to. That's going to be the point where no matter what perturbations are happening with the temperature around your home, it's going to return back to that thermostatic set point. So we can actually take that principle and model that with a lot of aspects of human psychology. This works really well for a lot of different kinds of data from that perspective. So we can model set point, but then we can also model how quickly the system returns back to that set point when it's pushed away from it. So when someone opens the door in your house, the temperature is going to drop, and it's going to take a moment for the temperature, for the thermos to kick in and get back to that homeostatic equilibrium. So just based on this way of using a straight line, we've now been able to get more insight into the way that we're looking at the data. So we're taking time series data, now we've got this concept of a set point and stability, and we can start being more creative. And then finally, we can actually expand and add other terms to this equation in order to get a better sense of other things that are happening within the system. So when it comes to burnout, we're also really interested in attention. That's related to that reduced cognitive capacity factor I was talking about a few moments ago. So we can look at how these two variables co-occur together across time. The technical term is coupling. You can also think about this as a time series-based correlation, more or less interchangeable. And now we can start getting into a description of what's actually happening, both on the individual level and at the organizational level. So what we do at Bit Cortex is we do gamified engagement surveys in order to take what would typically done over the course of an hour, break it up over multiple little mini segments in order to generate that time series data so we can collect what the HR professionals would already want to be getting, but then also get this additional wellness data that we can use for estimating burnout risk and integrate that into their operational strategy. And we can use this in order to reduce inequalities within the workplace, with one of the key areas that we're focusing on being neurodiversity. So thinking about people with different brain types and how we can better leverage their strengths and supplement their weaknesses so they get to thrive in their job positions. So given that I've only got 5 minutes, I want to save some time for questions. We can look at things like whether or not the risk tolerance for people with ADHD. This tends to make them really good in sales positions, really good in entrepreneurial positions, not so good in data entry positions. They tend to be very stress adapted, so meaning they're really good in chaotic, fast-paced environments. Again, maybe not so good in an office-based job where they're just sitting in front of a computer all day. So again, putting people in a position where they're optimally going to thrive. And because people with ADHD, their brain network is actually functioned towards task switching as opposed to focus work. So again, the more different hats they need to wear and the more they can have little changes in their day, the more they're going to feel like they're operating within their prime. So this is the kind of data that we're able to collect from our platform and able to help the HR professionals do a better job of facilitating people within the workplace and as a result reduce that burnout risk. So this is a quote from our first customer. I'm going to skip this for now because I want you to be able to scan this while we have some time for questions. So this is a QR code that'll take you to a 4-day demonstration in order to learn about neurodiversity as it relates to some of those ADHD factors. And for the remaining 3 questions, hopefully we can get remaining 3 minutes, hopefully we can get some questions in there. Back in the corner.
Yeah, can you speak a little bit about the data that was used to come up with that derivative equation that you showed? So are there clinical studies backing that up, or what's the data feeding into it? How do you know it works?
Yeah, so that analytic approach comes from nonlinear dynamics. So one of my supervisors at the University of Utah, he's published extensively on how that particular equation works really well in a data agnostic way. So as long as you have time series data and you have a complex system, it doesn't matter what the specifics of the data are, it tends to do a reasonably good job of replicating that thermostat dynamic. And then you can have more complicated articulations, as I started to allude to. So you can also model oscillations. So the fact that you have something that's going up and down. So I could have a further conversation with you in detail about like some of the different ways that you could use that in different data streams.
Well, I'm a mechanical engineer by background, and we had a very similar equation to measure stability in mechanical systems. So I'm just curious, how does that relate to human stress levels?
Oh, okay.
Equation modeling both things, like.
Are you referring to autoregressive models?
No, we we just had how long does a mechanical system or a bridge oscillation takes to come back to,
Oh, okay, yeah.
to a stable state, right? And very similar equation. So is it like a God equation that can model both systems, which are so different? So just curious, like, is there empirical data supporting the equation?
Yes. Yeah. So I've got that one paper that is published based on looking at this for modeling human cognition. That's the only one that I published. Again, my supervisor has extensive publications on this model for other types of psychological data. It's got applications in engineering. He's done some collaborations with that. I think in particular in relation to disaster relief. So again, what happens when your complex system is perturbed in some way, then you can model how quickly it returns back to its homeostasis. I think you had your hand up as well?
Yeah, the mechanical engineering background is you're basically modeling a controls problem.
Yes, yeah.
You're just applying different kinds of data, in this case, like a stress response instead of like a spring.
Yes, yeah. The technical term for the equation that I said is you can it's an order parameter. So it's weird in that you have your the variable that you're interested in both of the outcome as well as on the predictor side of the equation. So it kind of is weird from a typical regression sense that way, but then it does allow you to get that time series component.
And you said that's an autoregressive model? Or?
It's very similar to an autoregressive model. It's modeling the same thing with slightly different assumptions.
Thank you.
Yeah. Yeah.
What is the source of the points basically? How do you actually measure those oscillations?
Which oscillations?
That you showed in your charts. That actually the stress.
So this is an example of data that we can collect from our app. So again, we'll ask people to rate their stress on a day-to-day basis, and as a result, we can get time series data that looks somewhat like this.
Not a physical sensor, nothing like that.
No. In psychology, we don't have the privilege of, until very recently, having good time series data. So it's usually based on, please fill out a questionnaire every now and then. We're just trying to gamify that process so that people want to fill out said questionnaire.
Oh, like I did
Yeah. Yeah, but you can apply this model to other types of biometric data that you can get at. I was really interested in brain waves. You could do the same thing for heart rate. It's been used extensively for modeling heart rate. Yeah.
Yeah, I think my question kind of relates to how do you integrate more quantitative, non-cognitive data into your model, because right now you're still looking at, your issue is the fact that people have stress going on, their emotions are deregulating, and you're just using a survey to gauge somebody's stress, and now you're just doing it over a longer period of time, of 7 days.
Yeah.
But it still doesn't change the fact that maybe this week I had a job loss, a family member died, like these other things that could be actually affecting my hormones in my brain. It could affect the actual way I'm looking at life even over 7 days. So how are you going to use more non-cognitive reasoning or non-cognitive justification in your data to support your problems in counseling and things like that?
Yeah, so you're exactly heading towards some of like the next features we want to integrate, which is looking at more like Google Health, Apple Health type data, because again, you can get passive data streams that way. The other methodological solution we have to that is just doing that 7 days repeatedly. So doing it once a month or once a quarter, because really the issue you're talking about is a sampling problem. One of the biggest issues when it comes to psychological assessment is that you'll do a really extensive deep dive, but it's only one time point. So if someone did lose their job that week, you have a whole bunch of bias. Whereas if you sample at multiple different points, then that bias gets mitigated when you look at the more holistic picture. Yeah.
What's the kind of conversion rate, I guess? Like if I install this app, did it once, how many people do it twice, percentage-wise? How many people out of those who did it twice do it 3 times, kind of thing?
That's the thing that we're actually trying to model right now. I think we're at about a 25% conversion rate, if I'm not mistaken, based on some of the demos that we're doing. Again, in order to get buy-in, this is where we want to work with HR professionals and other people that provide wellness services, because then they got the buy-in from their clients, from their workforce, in order to get that adherence to the protocol. It's a really big problem, mental health, to get people to do things that they don't want to do, even if it's helpful. So this is where we're trying to use gamification to actually engage people in that process.
Can you give examples?
So within our app, we have a game that measures attention based on reaction time. So you're moving a cube and, of course, different lanes, and based on the pattern of reaction times present in that game, we can make inferences based on your attention from a very similar kind of model. Basically, if the stability of your attention is really low, your reaction time is going to be all over the place. So it might be like, good, 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 oh, I forgot. Good, 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 oh, I forgot. So we can use a similar kind of model that way to make estimations about your attention cognitively. So that's one of the ways we're trying to mitigate some of that psychological bias from self-report. Really good questions.
Going back to the survey part, how do you compensate for the fact that people will interpret differently an option? So I would say high is 80%. Somebody would say high is 60%. How do you compensate for that?
So there's two different answers to that. One of them is between subjects comparisons, and one of them is within subjects comparisons. So one of the fun things about human psychological data is that we're all unique, which means we can't necessarily apply the same model to everyone and have it work. So the way that psychologists typically gotten around this is by giving that survey to many, many people, typically hundreds, sometimes thousands. Then you get a normal distribution, so that way it doesn't matter if you interpret it slightly different than this person. You have enough of a sample within the population that your scores can be more directly compared as a Z-score. The other way that you can get around that is looking at within subjects. So what's your personal baseline? What's your set point? What's your stability? And does this change from the first time you did it to the second time you did it? Yeah, so really good question there.
How do you validate the responses from the game? Run it over the psychometric test just to validate if this is correct?
So we actually don't validate those. We use questionnaires that are already validated. So in order to validate a questionnaire, it's actually quite a bit of work. You have to give it to a large number of people, like I was just saying, in order to get those correlations. So we only put questionnaires up on our app that come from the scientific literature as being pre-validated from other scientists. So that way it has that evidence-based component to it. Yes. Ooh. Okay. I was about to say, on that note, we're wrapping up. So more than happy to take questions from other people afterwards, but thank you so much for listening to me speak. Hopefully this was a good discussion.